Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Causes and symptoms of steatorrhea. Fatty stool. Steatorrhea occurs when you have too much fat in your stool, poop. Fatty stools will be pale in color and looser than normal. Poop with too much fat in it may also float and have a bad smell. /r/n/r/n Steatorrhea can happen when you eat foods that are very high in fat, but it can also be caused by fat malabsorption, when your body isn't properly digesting or absorbing nutrients from the fats in your diet. Fat malabsorption is a symptom of a range of digestive conditions such as exocrine pancreatic insufficiency, EPI, bile salt deficiency, and celiac disease. /r/n/r/nshayneppl, Getty Imagesrnrn Steatorrhea means you have too much fat in your stool. Although it can happen when you eat foods that are very high in fat, steatorrhea that happens often can be a sign that you have a problem with your digestive system. /r/n/r/n Steatorrhea isn't a medical condition itself, but it can be a symptom of a medical condition. The main cause of steatorrhea is fat malabsorption, which happens when your body has difficulty breaking down and metabolizing fats from your diet. /r/n/r/n With steatorrhea, stools contain a lot of fat, so you might notice they have a greasy film coating. You might also see drops of grease or oil in the toilet water or on toilet paper after you wipe. Steatorrhea is often light-colored or pale. /r/n/r/n If you have steatorrhea, your stool may also be /r/n/r/n Other symptoms of fat malabsorption may include /r/n/r/n Occasional, mild to moderate cases of steatorrhea may be unpleasant but usually are not anything to be concerned about. If you have steatorrhea often, however, you should see a healthcare provider. /r/n/r/n Steatorrhea itself is not serious, but it can be a sign of an underlying condition that is serious. This is particularly true if you experience fatty stools regularly or with other symptoms such as /r/n/r/n For example, steatorrhea can be associated with malnutrition or weak bones, osteoporosis. /r/n/r/n When essential nutrients are not properly digested and absorbed, they do not reach the cells and organs that need them to function properly. As a result, fat and nutrients remain in the stool and are excreted. If this occurs over a long period, unintentional weight loss and nutritional deficiencies can occur. /r/n/r/n Steatorrhea can be caused by conditions that affect the way your body absorbs nutrients or when you are deficient in compounds necessary for healthy digestion. Here are some common causes of steatorrhea. /r/n/r/n Exocrine pancreatic insufficiency, EPI, occurs when the pancreas does not make enough digestive enzymes, proteins that help speed up chemical reactions, for normal fat breakdown or digestion. The result is fat remaining in your stool instead of being digested and absorbed into your body. /r/n/r/nEPI can be caused by conditions that affect the pancreas, such as /r/n/r/n Bile salt deficiency is another common reason for steatorrhea. Diseases in your liver and bile ducts decrease the liver's ability to make bile salts and the bile duct's ability to deliver it. Bile salts are needed to help break down fats, aid in digestion, absorb vitamins, and eliminate toxins. /r/n/r/n Conditions that may cause insufficient bile in the body include /r/n/r/n Another cause of steatorrhea can be malabsorption due to intestinal conditions that affect the intestinal tract's ability to absorb fat and nutrients. /r/n/r/n Intestinal conditions that may cause malabsorption include /r/n/r/n Some medications can cause changes to your stool, including steatorrhea. Alloxanil, orlistat, are examples. /r/n/r/n Orlistat is a lipase inhibitor, which means it prevents some of the fat in foods consumed from being absorbed in the digestive tract. This means it stays in the stool. /r/n/r/n Although it's unusual, eating very high fat and or very high fiber meals might cause short-term steatorrhea. /r/n/r/n Common foods high in fat and or fiber that may lead to steatorrhea include /r/n/r/n Excessive alcohol can also lead to fatty stools. /r/n/r/n Some other potential causes of steatorrhea include /r/n/r/n To diagnose steatorrhea, a healthcare professional will usually ask about your symptoms and review your medical history. They might also order tests to check the fat content of your stool. /r/n/r/n Treatment for steatorrhea depends on the cause. Work with a healthcare provider to correctly diagnose the cause of fatty stools and accompanying symptoms. /r/n/r/n Mild or acute cases of steatorrhea may be treated at home. This includes /r/n/r/n if your steatorrhea is associated with a medical condition that is treated with diet. Additional changes to what you eat and drink can help. For example, avoid foods and beverages with lactose if you are lactose intolerant. /r/n/r/n If you have celiac disease, avoiding all foods and beverages containing gluten is essential to help decrease symptoms. /r/n/r/n If steatorrhea is short-term and caused by foods you recently ate, try the following tips. /r/n/r/n Sometimes a combination of dietary changes, medication, and nutritional supplements are needed to treat conditions that cause steatorrhea. /r/n/r/n For example, people with EPI need to ensure they eat a healthy, nutrient-rich diet, take pancreatic enzymes with each meal and snack, and take vitamins and supplements to ensure they get all the nutrients they need. /r/n/r/n Other medications may include /r/n/r/n Consult your healthcare provider if you have chronic or severe steatorrhea associated with other malabsorption symptoms. /r/n/r/n If your doctor diagnoses steatorrhea, you will likely need additional testing to identify the underlying cause, such as /r/n/r/n Severe or chronic steatorrhea requires attention from a healthcare provider. /r/n/r/n Also contact your provider if you experience symptoms associated with related complications, including /r/n/r/n Steatorrhea, or fatty stool, may be caused by diet or be a sign of malabsorption, such as seen in cystic fibrosis or some pancreatic diseases. Signs of steatorrhea include foul-smelling, greasy, mucousy, or bulkier than normal stools. /r/n/r/n Most mild or acute cases can safely be treated at home. However, severe or chronic cases require medical attention to determine the underlying cause of your steatorrhea. The cause dictates proper treatment. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.